Avoid serious spinal surgery due to disc herniations and bulges. Hey folks, I'm Dr. Jeff Williams with Creekstone Integrated Medical right here in beautiful Amarillo, Texas, and I'm coming to you with a new video this week about how you can avoid surgery. Listen close here because this one really can change your life, and I'm pretty sure there are plenty of friends and family on your list that could benefit as well. So be sure and help them understand there are other options by sharing this information with them. If it avoids just one unnecessary surgery, well then we did it right. We hear it from our patients just about every week. I have a bulging disc and the doctor wants to do surgery. Whew, that's pretty heavy, right? But what if I told you that out of 56 million back pain sufferers, only about 5% of them truly need surgery? That's based on research. And what if I added to that and I shared with you the fact that research shows us that over 60% of 40 to 50-year-olds they've got bulging and herniated discs. 60% of 40 to 50-year-olds have bulging and herniated discs, but they have absolutely zero pain and zero dysfunction whatsoever. They'd never even know they had it if they didn't go get an MRI for research purposes. But again, 60% of 40 to 50-year-olds, no pain, lots of discs. So yeah, it's crazy. So many disc bulges and herniations, yet no pain. That's amazing. And that means a large number of patients are having spinal surgery when the disc injury they see on the MRI is not the source of the pain. They're getting surgery for things that's not causing the issue. And that's more than distressing. But it's also encouraging if you're looking at it right, because that means we can save a lot of folks from undergoing spinal surgeries because so many of them can be completely avoided with the right kind of conservative treatment. Before we get into our solutions for avoiding spinal surgeries, I want to share with you the most recent recommendations from the American College of Physicians with regards to treatment for acute or short-lived and chronic, long-lasting back pain. The American College of Physicians is a huge medical organization, biggest in the world, I believe. And for first-line treatments, they recommend the following: spinal manipulative therapy, chiropractors do that; targeted and specific exercises, chiropractors can do that; low-level laser, also known as cold laser, chiropractors do that; massage, I've got three massage therapists; acupuncture, we have an acupuncturist here; heat, we got heat; yoga, tai chi, cognitive behavioral therapy, and there's a few other, but you get the point. These are the good things. This is what you should be doing before doing any of that other stuff. But there's one more thing that needs to be added to the list. Those that know the incredible effectiveness of non-surgical spinal decompression know that it should be number one at the top of the list. Spinal decompression is safe, effective, conservative, painless, and is the number one way our disc patients can avoid spinal surgery. It's the epitome of what we can call a game changer with regards to helping to heal discs and sore backs. Before we get to that though, I want to let you know what an injured disc even is. Between the bones of our spines, we have a cartilage, little circular padding that acts as a shock absorber. It's built kind of like a jelly donut. It's got a jelly center and a hard outer ring that's made of cartilage. And that cartilage, through aging or injury or a score of other reasons, can develop tears in it. And those tears will allow the inner jelly to either bulge or completely push all the way through the outer ring. And that's ouch. I mean, that's big owie. When this happens, people are many times basically disabled for a certain amount of time. Sometimes they stand crooked. Sometimes they can't bend forward, can't even walk, and sometimes simply can't find a comfortable position at all. Lying down, sitting, nothing. Everything hurts. Still, others will have pain running down into an arm or a leg, for example, and this is called radicular pain or radiculopathy. It can feel like burning or tingling or a shocking kind of pain. These are all common characteristics of a disc injury, and they can be life-changing. And to be honest, they can be downright scary. It's usually about the time that this patient would go to their family doctor or the emergency room. And I've got to say, most family doctors and most emergency room doctors do not specialize in musculoskeletal or spinal conditions. You can't be an expert at everything. They are amazing doctors, but you can't be an expert at everything. Nobody can. Since a general family practitioner or an emergency room doc does not typically specialize in these sorts of complaints, they also don't typically know the best place to direct the patient based on current guidelines and recommendations. For example, a great evidence-based patient-centered provider can typically handle disc injuries fairly quickly and effectively without the need for any surgical intervention. And these providers can be chiropractors or physical therapists or something along those lines. A good evidence-based chiropractor is well schooled in physical therapy type exercise. Chiropractors use spinal manipulative therapy, spinal decompression, targeted and specific exercises, and low-level laser, and they can usually handle these conditions, like I said, quickly and with ease. The problem here is that the family physician or the emergency room doctor does not typically know or understand these things. Although relations have drastically improved in recent decades or so, 5 to 10 years, the professions have not traditionally worked well with each other over our histories. And that's the main reason the knowledge of what our colleagues can or cannot do, or how they can or cannot treat, it's not always at the level one would hope for. This also explains why patients that should probably be directed to a conservative practitioner based on research, it's why they get railroaded down towards unnecessary MRIs and unnecessary spinal surgeries. And here's another golden nugget you need to remember. Research by a guy named Keeney and his colleagues over in Washington State, they showed that state workers with work-related back pain that visited a surgeon first, they ended up having surgery 42.7% of the time. Woo! If they went to a surgeon first, they had surgery 42.7% of the time, because when you got a hammer, everything looks like a nail. While another group of work-related injury sufferers who visited a chiropractor first, same sort of injuries, went to a chiropractor first, they only had surgery 1.5% of the time. Whoa! For the same types of injury, 42.7% of the time they had surgery when they went to the surgeon first, versus 1.5% of the time, only 1.5% of the time when they went to a chiropractor first. If that doesn't open your eyes, I don't think there's anything I can do for you. But I'm telling you, these are the things that keep evidence-based, patient-centered chiropractors awake at night. How do you get across to people that they should be visiting an office like Creekstone Integrated Medical Clinic right here in Amarillo, Texas, before going to a surgeon and before going to pain management, before having pain stimulators implanted in them, before having cortisone shots in their joints that eat up their joints, before having their nerves burned, before taking opioids that are dangerous and addictive, and definitely before having back surgery that has been shown to need to be repeated in about 50% of the cases. You almost never need spinal surgery if you're going to the right provider. So, how can the providers here at Creekstone Integrated Medical make a difference for you in your life? Well, I'm glad you asked. First, we have West Texas's only chiropractor with fellowship training in orthopedics. The only one all the way down to the Mexico border, and one of only about 20 in the state of Texas. And that means that we can usually get to the source of the issue quickly. And in healthcare, it all comes down to the most accurate diagnosis. So this part really matters. Plus, I'm getting my second fellowship in forensics. This is all really important and really helps to get the diagnosis as right as it can get. When the issue is a disc bulge, disc herniation, facet arthropathy, radiculopathy, or stenosis, spinal decompression combined with low-level laser right here in our office is the first and most important thing. There is nothing quite as effective in treating disc issues that I've seen, and I know chiropractors and colleagues all across the nation. We have had many patients tell us that they tried decompression elsewhere, but they didn't get any results. But once they try it here, they're typically convinced. We were trained in the Kennedy decompression technique, and we can typically get our patients results when others couldn't. I understand that may sound a bit braggadocious, and I apologize, but when our goal is to help our patients avoid life-altering surgeries, sometimes it's better to just lay it out on the table and say, look, we can almost always help you avoid surgery, even if you've tried chiropractic somewhere else, or you've tried decompression somewhere else and you didn't get good results. We usually can. After all, it's not usually chiropractic that failed, or it's not always physical therapy that failed, or this doctor or that provider. The majority of the time, it's the provider that failed, and all you had to do was find the right provider for you and your condition. Now, continuing on, spinal manipulation is based on movement, and movement is healing. Motion is the lotion for joints. An evidence-based chiropractor is uniquely positioned to leverage spinal manipulation to get our patients back to normal faster and more effectively, especially when combined with exercises that are specific to the patient's injury. Which is a good segue to talk about exercise. Many chiropractors are trained in physical therapy type exercises and physical rehabilitation. When trained correctly, we can take the accurate diagnosis and help lead you in exercises and moves that have been proven to improve the specific complaint. Sometimes bending forward to touch your toes, it's not the best thing for you when you have a disc injury. In fact, I would say most of the time, patients should be doing exercises that emphasize extension at the waist rather than flexion, at least until it heals up. And that's why I say it should be targeted specifically to the condition, because some exercises aggravate certain injuries. Exercise is excellent, but not all exercises in all situations. In addition to all of these means of treating a fussy disc injury, we also offer medical services that can help our patients get well quicker and recover. Treatments like trigger point injections that can treat and eliminate knots in the sore and guarding muscles in the area. We can also use platelet-rich plasma to hit the region with healing that can help repair injury quickly. Not to mention something for the pain when appropriate and deemed necessary. We also believe strongly in educating our patients about what chronic pain really is, why it occurs, and some symptoms of being in chronic pain syndrome. The first step to controlling chronic pain is to understand it, and that's where we come in. So these are just a few of the ideas on how we can treat disc herniations here in Amarillo, and how we can help our patients avoid spinal surgery. Back surgery and neck surgery, they're painful, and the recovery process, it's a long one. Not only that, but 50%, like I said, have to be repeated. So it's time for a mental shift in how you and how your family and your friends view spinal pain and how spinal pain should be treated. The most current research proves that an integrated clinic like Creekstone right here in Amarillo offers a clinic like ours that is offering medical services, evidence-based chiropractic care, exercise, spinal decompression, laser, acupuncture, and massage. Clinics like this should be the #1 first stop for these injuries. If you're in the Amarillo, Texas area, or you're going to be traveling through and you need to be seen, why don't you call us right now at 806-355-3000. Let's get you on the schedule, and let's see if we can get you back on track. If you're watching on YouTube, subscribe, comment, and share. We'd love to hear from you. If you're on Facebook, like, comment, and share. Again, help your people out by making sure they know there are other options to having surgery that they probably didn't need in the first place. I'm Dr. Jeff Williams. Thanks for watching. We'll see you again next time.